Hi, my name's Garth Maker and I work at Murdoch University in Perth. My area of expertise is in toxicology and biochemistry, so the study of poisons and the study of the chemistry of living cells. And where I apply that is in research into herbal medicines and dietary supplements. So what we're really interested in is understanding the quality and the composition and the safety of these products. So we do that using a number of techniques. The techniques that I use most frequently are ones called chromatography and mass spectrometry. So chromatography is a chemical analysis technique that allows us to separate the different compounds that are in a particular mixture. And mass spectrometry is a technique that basically very accurately weighs the molecules in the sample, determines their mass, and also allows us to figure out how much is there. So between these techniques, we can figure out very accurately the chemical composition of a particular herbal product or supplement. We've also used other techniques like next generation sequencing to identify which species have been added to a particular product. The reason why we do this research is that it's very important to better understand these products. They're very popular in Australia and many other parts of the world. The majority of the population uses them on a regular basis. So what we want to understand is what's actually in these products. And by doing that, we can understand the differences we might get in quality and in effectiveness, and also any safety issues that might arise. So for example, I might grow a particular plant here in Perth, and you might grow one on the other side of the country, for example, and that would experience different climate, different water, different soil, different bacteria, and all those things would mean that the final chemical composition of the product is very different because the biochemistry of the plant would be affected by all of those things. But we might sell them as the same product, which would therefore mean that people wouldn't know that there was a difference between them, and it might have an effect on the quality and the effectiveness. At the same time, sometimes plants produce compounds that can be toxic, so we are also interested in the safety of these products. And sometimes they have other pharmaceutical things like aspirin or Nurofen added to them that might have an effect on the safety as well. Fortunately, that doesn't really happen in Australia, but products that are purchased over the internet sometimes do have this issue. As you can imagine, this type of research requires us to buy a lot of herbal products, so we've sometimes got a little bit carried away creating complicated backstories for ourselves as to why we need to buy so many herbal products, and it's often become a little bit of a competition as to who can come up with the most ridiculous story as to why we need to buy 20 or 30 herbal products in a single transaction. So hopefully that gives you a bit of an overview of the research that we do and why we think it's super important. Thanks.